One of the things that we're seeing is a lot of peers and providers are looking to kind of maximize their reimbursement before the end of the year. But more importantly, they're trying to get those incentive payments, right? So what are incentive payments? What are we trying to do here? Well, this is a big organization that's been set up to kind of help manage the process of ensuring that certain things are met so that patients get the best quality care. If you're a doctor or medical provider, your incentive bonuses are tied to that as well. And so there are certain things that you can do today that can help impact that. One of those things are utilizing is end of the year. How are you with your quality measurements? Here's some key strategies to get your quality measurements up before the end of the year. The last one is really important, so pay attention. Yes, there are certain things you can do to make sure you have the best quality metrics if you're in healthcare. HEDIS measurements are so important, not just for payers or insurers, but also for providers, because that allows you to get your maximum amount of reimbursement and incentive payments before the end of the year. But there's only a few measurements that you can really target, considering we only have a few weeks left here at the end of the year in 2024. So if you don't know, I'm Theo Harvey. I'm the co-founder of SensorMed. We are a remote care as a service program that works with providers, healthcare organizations, and payers to help them manage patients remotely with programs consisting of chronic care management, remote patient monitoring. And we do this by implementing blood pressure monitors, kidney disease or diabetes monitoring. And so we have a plethora of programs that help patients remotely. So we've been in this industry for several years and really understanding how we can impact patient care across the spectrum. One of the things that we're seeing is a lot of peers and providers are looking to kind of maximize their reimbursement before the end of the year. But more importantly, they're trying to get those incentive payments, right? So what are incentive payments? What are we trying to do here? Well, HEDIS, this is a big organization that's been set up to kind of help manage the process of ensuring that certain things are met so that patients get the best quality care. Payers adhere to it. A lot of large organizations adhere to it. Also, if you don't know, if you're a doctor or medical provider, your incentive bonuses are tied to that as well. And so there are certain things that you can do today that can help impact that. One of those things are utilizing blood pressure monitors. What does that mean? So basically there is a measurement controlling blood pressure. So if your patients have uncontrolled blood pressure, one of the metrics is trying to get them at that 140/90 designation. If you can do that, then your patients are under what they call controlled blood pressure. And so one of the things you can do that is making sure you reach out to all your patient populations, or if you're a payer, all your members, and making sure that they meet the qualifications to meet that standard so that you can close that gap. It's really about when you're trying to get your maximum amount of incentive payments, it's really important to ensure that you close that measurement as soon as you can. And at the end of the year, if you're missing that measurement, if your numbers are not where they need to be, then this is a perfect time to go reach out to those patient populations that can help you meet that measurement. And something as simple as calling them and making sure they get their latest reading and making sure that reading is meeting that measurement amount, right? One of the things we've seen also, this is so important. Why, you ask? Well, what we've seen is if you can increase your measurements, your quality measurements, that has a huge impact. We're seeing incentive payments helping you increase anywhere from 13 to 17% in incentive payments coming back to your organization. So something as simple as 1 star increase for any one of these measurements can really help move the needle for you before the end of the year. So it's imperative that you try to close these gaps before the end of the year. What are some other gap closures you can look at? Well, one of the things we saw are a lot of the testing gap closures. So those are the ones that deal with, for instance, colorectal screening. They have test labs that you can be sent to the patients, or calling the patients proactively and making sure they come in to get that done before the end of the year so you can close that gap. Typically colorectal or for patients that are 55 and above, making sure they do that. And there's several different ones. Obviously, if they have a colonoscopy, that tends to last for over 9 years, so you may not have to worry about that member or patient. But if you have a situation where they haven't done a colorectal or they haven't done a colonoscopy, then there are lab tests that you can send out to the patient, and that allows you to kind of meet that requirement for the next year. And so looking at your patient populations to determine which screening they can take advantage of to meet that care gap is really gonna be important before the end of the year. Also, breast cancer screening, right? Making sure you know what members you can target to kind of reach out to make sure to get that done before the end of the year. This is a great time to do it because a lot of patients and members are looking at ways to kind of meet certain guidelines. So if you create some kind of incentive to get them to come into their office, and if they're already talking to you as a provider, a doctor, one simple way is asking them, have they done any of these screenings, right? Like breast cancer screening or colorectal screening, right? And those are the things that you can do while they're in your face, because a lot of times patients, they met deductibles, they're trying to get in their last screenings before the end of the year. This is a perfect time to ask them about a simple test that can be done and takes maybe 20 minutes of their time. So this is a perfect time to ensure you close those gaps, right? Another key gap is the diabetes gaps, right? The glycemic status for patients with diabetes. It's the GSD program. And this care gap can be met by ensuring patients have A1Cs below 9%. One of the key things you can do with that is making sure you're measuring patients' A1C is typically a holistic measurement over 90 days. So when you talk to your patients, making sure when's the last time they gotten tests, right? And making sure you do that test to ensure they kind of meet that measurement. If you saw they haven't gotten the A1C test since January, this is a perfect time to kind of retest them, especially if they were over that 9% and you've been guiding them over the years. So this is a huge time to kind of reach out to those members and those patients that you saw that were over that 9% A1C level to see if they went down after some coaching from you earlier this year. One of the things that we see to prepare for next year is you want to start looking at how can you take advantage of continuous glucose monitors, right? Those are just devices that are wearable devices that patients can utilize, ensuring that you're measuring their glucose levels at an effective rate, ensuring that they're meeting the guidelines for all the things that comes with diabetes, right? And we've seen when patients wear those wearable devices, they're more compliant, making sure they meet their daily sugar levels. A lot of these programs, they have an app that the patient can see. If their blood sugar spikes up, they can see what spiked it up, typically extra sugar or any other incidences, especially during the holidays, right? Making sure that patients have these kind of continuous glucose monitors. We're seeing it being very effective in changing patient behavior to monitor what they eat, but more importantly, be more cognizant, more aware of what they're eating so that their blood sugars don't spike up and get into that hypoglycemic area. Another thing you can kind of look as, are there any of those surveys that you can do, right? One of the big one is the social determinants of health. Making sure you're kind of surveying patients around their food insecurities, understanding their transportation needs, understanding if they have caregivers that can help them. So that's a simple survey. If that hasn't been done yet, that can be done to kind of close that gap before the end of the year. These simple things are really key in order that you can close these gaps a little bit more effectively before the end of the year, because as you prepare for 2025, you want to make sure you're going in on the right notes, right? Because these patients, obviously these measurements you're taking now won't be effective for another year or so, but it's important to kind of build that infrastructure intact. Ensure your team is doing the little things they can to ensure that they close those gaps more effectively, because as the next year rolls around, and as we're filming this 2025, then you want to make sure that that team understands the little things they did back in December of 2024 that can take an effect and can build on that momentum, right? Because gap closure is really about your team, right? Making sure you have the right team, but also the right partners. Sometimes you may not have the capability to reach out to those patients at scale, but if you have the right partner, let's say for instance, organizations that can come in and kind of extend your reach to patients outside the clinic, outside the hospital, right? And that's typically, what companies like my company, SensorMed, does, right? Be able to extend your reach so that you can talk to patients at scale more effectively about their needs and how you can help them more effectively, right? Because patient care has now extended beyond the clinic, and especially for these quality measurements that you're being guided against and trending about. It's really important to make sure you kind of have the presence in mind to ensure that you're meeting those guidelines. One of the things that we've seen being helpful is making sure whoever you partner with, understanding how do they think about delivering care outside the clinic, outside the hospital, right? Do they have their own internal teams that can reach out on your behalf? Are they multilingual? So for instance, do the patients speak different languages? If so, does a partner have a way to communicate to the patient in their own language? As we know, having cultural sensitive communication with patients make them more accepting, but more important, they feel more trustworthy, right, to the individual that's speaking to them. And they're more willing to give up information or to provide more thoughts around how to care for them best. So making sure you have a partner that understands that. And then finally, we'll make sure a partner that's flexible. They understand the needs of patients at home. So sometimes the patients can be called at certain times. The daytime is better versus the nighttime. Sometimes it's better to have the patient call in and making sure you communicate with them. But having a partner that understands that can be flexible so that you can meet that gap closure is really going to be important. And if you're a provider, right, that's like, what does it have to do for me as a doctor, right, or as a doctor owner? This is very relevant to you, right? Because yes, you do get reimbursed on these remote care programs like remote patient monitoring and chronic care management. But if you're able to close gaps and deliver these programs at scale to your members, then not only are you getting reimbursements, but if you're part of like an IPA, Independent Physicians Association, or an accountable care organization, there are likely going to be incentive payments that you can take advantage of, right, that you weren't even aware of. So this is why it's important to understand holistically how these programs can affect your delivery of care. And these are programs that a lot of times you just don't have the capacity as a provider owner. Your team, nurse practitioners, your physician assistants, they just don't have the cycles and the capacity to deliver this at scale. So having a partner that can help you and partner with you to kind of deliver these care gaps and close them more effectively is going to be so key, especially as we get into more of these outsourced type services. So again, if we look at the things that you can do to be successful, you definitely want to make sure, number one, you look at these 5 different areas that you can close by the end of the month. First, you want to look at controlling blood pressure. That's an easy one to close because it's really about making sure the patient has controlled blood pressure and you're getting that data mark. And as simple as calling the patient, making sure they do a blood pressure reading, whether it's in the office or with some kind of remote device that can be qualified, and that you can capture that information and put inside the EMR or the electronic health record. Number 2, you want to look at your screenings. You want to look at your breast cancer screening, colorectal screenings, right? If the patient or the member has not done that this year, you want to make that an assertive effort to outreach and communicate to them effectively. You want to look at the new measurements around the CMIC status for patients with diabetes or GSD, and making sure you're preparing for that by ensuring a lot of your diabetic patients, if they're not already, but preparing them to maybe perhaps look at a continuous glucose monitor that's wearable, that you can track that A1C level more effectively. But more importantly, you want to make sure that you look at your patients that were higher than that 9% A1C level, and you want to outreach them to ensure you get that next reading measurement so it's less than that 9% so you can close that gap. And then finally, you want to reach out to patients from a culturally sensitive way and make sure you finish your surveys for understanding their social needs, their social determinants of health needs, doing that survey to ensure that you meet that quality gap as well. And then finally, you want to have an effective partner that can help you build this out, because guess what? These programs are going to become more required, right? Ability to kind of reach patients at home so you can close these gaps is going to be so much more important as we continue to scale up healthcare. So hopefully this was useful to you. Again, take these to heart. You still have some time, roughly about, as of recording this, about 3-4 weeks to go. You want to make sure you close these gaps and get them closed so that you can have a strong 2025 and really attack it strong and be forward in your thinking, because healthcare is changing before our very eyes. So I hope you enjoyed this. If you like this content, please like and subscribe. I also talked a little bit about outsourcing remote care as a service, so please look at that in the show notes. But again, if you like this content, please like, share it with others if you think it was helpful, and continue with us on this journey as we continue to develop healthcare in this new normal.